Good morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. So our topic for today is about Wilson's disease. So I am Nurse Edlene and your speaker for today. So what are the key points that we are going to discuss? So we have the definition, signs and symptoms, 4 stages, risk factors, diagnosis, treatment, and prevention. So what is Wilson's disease? So Wilson's disease is also known as hepatolenticular degeneration and progressive lenticular degeneration. So it is a rare genetic disorder that causes copper poisoning in the body. So it is an autosomal recessive genetic disorder, so nasa genes, and this manifests as neurological or psychiatric symptoms and liver diseases. So in a healthy body, the liver filters out excess copper and releases it through urine. So what happened in Wilson's disease, the liver cannot remove the extra copper properly. So the extra copper, it builds up in organs such as brain, liver, and eyes. So what are the signs and symptoms? We have fatigue, lack of appetite or abdominal pain, a yellowing of the skin and the whites of the eye. So it's called jaundice in medical term. So golden brown eye discoloration, Kaiser Fleischer rings ang tawag doon. And then fluid build-up in the legs or abdomen. So medyo namamagay yung mga paa or medyo may fluid accumulation sa tiyan or sa paa. And then problems with speech, swallowing, or physical coordination. And then uncontrolled movements of or muscle stiffness. Kasi nga, the signs and symptoms may vary depending on which organs is affected. So pwede siya sa brain, pwede siya sa eyes, pwede din siya sa liver or the kidneys. So what are the stages of Wilson's disease? So stage 1, the initial period of accumulation of copper within the hepatic binding site. So it means to say nasa liver lang siya. Kasi nga, yung liver natin, ang function niya is to filter all materials or lahat ng kinakain natin or even yung mga vitamins or mga food intake, the liver filters it. And then on the stage 2, acute redistribution of copper within the liver and its release into the circulation. So pwedeng mapunta na yung copper sa kidney, pwede na siya sa bloodstream, pwede na siya sa brain. And then stage 3, chronic accumulation of copper in the brain. Kapag left untreated yung condition na to, pwede siya mag-accumulate na sa part ng katawan, sa ibang parte ng katawan. So, meron na tayo sa brain, so mga extrahepatic tissue. So, napupuno na yung liver and then with progression na siya and eventually fatal disease na or sometimes dito na talaga nila nakikita or visible na yung mga signs and symptoms. So, saka consult yung mga patients. So kapag left untreated, so there could be life-threatening condition. And then kapag na-treat naman yung Wilson's disease on the stage 4, that's restoration of copper balance by the use of long-term chelation therapy. So ibig sabihin, hindi na siya mawawala, nandun na siya sa katawan mo. However, namamanage na lang siya because of the usage of medication. So what are the risk factors? So mainly genetic siya. So could be your parents ang carrier ng affected gene. So yung mga anak magkakaroon ng 25% chance of inheriting the condition when both of your parents are carrier. So pwede yung isa or yung dalawa carrier, yung dalawa meron silang sakit talaga na Wilson's disease. So how can it be diagnosed? Of course, the doctors will conduct series of tests such as physical examination, blood and urine test, eye exam to check the Kaiser-Fleischer rings, the MRI and CT scan. You're already familiar with that kasi nga it scans your organs and then it will also check yung damage din ng mga internal organs natin. And then liver biopsy. So when you say biopsy, you will undergo a minor procedure na kukunan lang ng specimen yung organ or area na kung saan yun yung iti-test or iti-check if it is not healthy or merong mga diseases na nagko-cause or ano yung mga causes ng specific disease to rule out the diagnosis. And then genetic testing. So genetic testing, yan yung way na malaman ng parents if yung anak nila is magkakaroon ba ng Wilson's disease or wala. So for the treatment, now since yung copper nag-accumulate na siya sa blood natin, ang ibibigay possible lang or may be given by your doctor yung mga chelating agents such as penicillamine, trientine or zinc acetate. So ito yung mga gamot na pwede nilang ibigay, of course, depending on the stage then. And then aside from the medications, your diet will be controlled. So it will have a control of food intake by reducing the amount of copper that you are getting kasi pwede nating makuha yung copper sa food or pwede din namang sa supplements. And then aside from that, taking zinc supplements, ang zinc kasi it prevents your body from absorbing copper from your diet. So, with the help also with the chelating agents, yung ginagawa ng mga chelating medications, it helps your body organs naman and tissues to get rid of the excess copper para hindi naman magstay doon sa internal organs mo. You have also to take vitamin B6. It's because it promotes brain health, eye health, and prevent eye diseases. So, yun yung function ng vitamin B6. And then if you have an extensive liver damage, you have to undergo a surgery. So pwedeng liver transplant from the dead person or pwede din siyang sa buhay. So it's called living liver donor procedure. Kung yung part lang naman ng liver mo, hindi naman yung buong liver ang affected, then pwedeng mag-donor yung buhay ng part ng liver niya as long as you are a family member or relative, and then ano din kayo, compatible din kayo para yung liver na ita-transplant hindi din masasayang. So they are called living liver donor. So that's a procedure na ginagawa din if yung part lang naman ng liver ang affected. So there is no cure. So lifelong treatment is needed to reduce the amount of copper in your body. Pero wala talaga siyang, hindi natin siya masasabing na mawawala talaga siya sa katawan. So prevention, so there's no way to prevent it. It's because it's genetic. So you can hand it over or pwede siyang maipasa through genes nga sa mga anak. So you can ask help for genetic counseling para at least yung future or your current children, they will be detected if they're at risk for Wilson's disease. So yung genetic specialist can help the parents determine if they are potential risk for passing the Wilson's disease. So if na-detect yon earlier, they could at least delay or slow down the onset of the condition kasi kapag na-detect naman siya on the earlier stage or let's say bata pa, hindi mo makikita yung signs and symptoms, walang signs and symptoms. Pero as it progresses or habang lumalaki yung baby, pwedeng mag-show yung signs and symptoms na mention ko kanina. And then early diagnosis and treatment can reduce or prevent organ damage or life-threatening conditions. So early diagnosis is really crucial for slowing or stopping the progression of Wilson's disease. So treatment may involve taking medication or getting a liver transplant and lifestyle modification then. And then you have to get a proper treatment to avoid any liver failure, brain damage, and other life-threatening conditions. Okay, thank you for listening, guys. So if you have any concerns or suggestions, you might contact us through APOSI Clinic team. So goodbye, everyone, and have a great day.